Thanks for watching AM Northwest. You know, as we age, our upper eyelids can droop, not only making us look older, but sometimes obstructing our vision. Here with help, we welcome back from Aesthetic Medicine, Dr. Jerry Darm, along with patient Sherry Chism. Good to have you both with us. Dr. Darm, good to see you again.
Nice to see you,
Sherry,
too.
let me start with you. Tell me, what is it that you saw that bothered you when you looked into the mirror?
My eyelids were sagging, and so when I put like on eyeshadow, it didn't look good. And my lids were actually on my eyelashes, so you just couldn't see my lid at all.
And was it obstructing your vision? Or
a little
was
bit.
And then did you just not feel good about yourself? We're taking a look at the before and after here. So tell us what you see when you look at the before and after. Does it feel good now, Sherry?
Yes, absolutely.
Okay, and Dr. Darm, when she came in to see you, what did you see?
Well, in a lot of patients, as they age, the skin underneath the eye and over the eye becomes loose, and it can even obstruct the vision. So one of the most common plastic surgery procedures that's done is called the blepharoplasty, where you take the skin, remove some of it, tighten it up, take a little bit of that fat pad out, because, you know, the bags, so-called bags under the eyes.
Oh, I know those, yeah.
are really...
They make you look tired and old,
Yes.
you know, really.
Yes.
And so when you do something like that, do you inject fat or you take away fat? How does that work?
Well, from the underneath the eyes, a little bit of fat is removed as the skin is tightened, and then from above the eyes, it's just a reduction of the loose skin, basically. But it's a very tricky procedure, even though it's one of the most common ones that are done. And so...
Is that because you're working around the eye?
Oh, well, and it's just, there are different techniques that are used, so it's really, really important to find somebody who knows what they're doing, basically.
You also said you did fat grafts. Explain how that works.
Well, with Sherry, we took some fat from her tummy, I guess, or from the thighs, and put it back into the face. So, in other words, filling in areas here, putting a little bit into the lips,
I see.
And putting a little bit into the cheeks. So it's sort of filling out those areas.
When someone comes to see you to get a consultation, and they're concerned about one thing, and you see something else that could be improved, do you point that out? Is that kind of a tough one?
It's tough, yeah. I mean, it's tough. Sometimes there'll be a mole, big mole, right on the end of the nose.
And they don't see it.
And they don't see it, right.
But you think, oh, maybe this...
But I'll probably mention it. You
yeah.
know?
Since we're going to do this anyway, why don't we do that?
Let's just throw in the mole.
And you also had your eyebrows, right, evened out so that one was looked like the other, right?
Correct.
And how do you feel now?
Really fresh. I like the way I look.
And
I really do. I used to focus on what I didn't like,
right?
And now I don't do that anymore.
And what's the reaction you have from friends and family?
They know that something's been done, or I look different, but I didn't tell a lot of people when I'm on TV. But they just notice that I look fresh. I don't look tired.
Right.
They just look at me and go, "Wow, you look great."
And they don't know why. What's the recovery time for something like this?
That's about a week or 10 days, and you wear dark glasses. But of all the plastic surgeries, it's probably the least invasive and the least painful.
And how was the procedure for you when you came out of it?
It was fine. It wasn't painful at all.
And so you would recommend Dr. Darm to your friends?
Absolutely, 100%.
And again, the procedure is called what?
It's a blepharoplasty.
Okay.
It's the eye surgery, basically. And so it's, you know, removal of the skin, redundant skin, taking away the bags, and then also working on the upper lid, as well as, in her case, you know, she had the fat transplants from elsewhere. So, gosh, just a great result, a very natural look, as you can see.
Yeah, exactly.
And that's the goal, to make you look the way you did 10 years ago or 15 years ago.
Not that you've had work done.
Right.
And not be obvious that you've had work done.
Absolutely. Well, we want to tell folks if they'd like to find out more about aesthetic medicine, the number is 503-697-9777, and we can put all that information for you on our website at k2.com. Thank you both very much.
Thanks.
Thank you.
You look great.
Thank you very much.